So this is the typical appearance of the renal function test. So this is very recent report. A male, 54 years, admitted to the private hospital with right side colic pain. So I'll explain what is colic pain, and also a low urine output, and also patient had vomiting. So that initial, because it was a renal case was suspected because it is typically identified the OPD doctor as a renal colic or urinary colic. So that we requested several blood tests. Normally, that is the standard procedure because patient is kind of have got scared and he's kind of shivering and complaining because it's a renal, the urinary colic is a very high pain. So then it's a very unbearable pain. So that this is interesting. The patient did not have diabetes and sugar problem. Simply that means uh, hyperglycemia and cholesterol problems. So this is the report. Okay, we'll get back to report. So that renal profile is, so we normally we call renal function test, right? So kidney function test. So why it is done? So this is the basic test. There are so many tests, but normally we take this as initial assessment, right? So why it is done? So because kidney filter waste product and toxin from the blood, and kidney regulate fluid and electrolyte. So maintain acid base balances, then control blood pressure. Kidney important control blood pressure and help in red blood cell production via erythropoietin, right? So the renal function test help us to identify kidney disease or dehydration, kidney disease or damage, dehydration, electrolytic imbalance, and impact of condition like diabetes and hypertension on kidney. Right. So normally you can see now here renal function test in a typical test, you get a blood urea nitrogen, BUN, 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 creatinine, serum sodium, serum potassium, serum chloride, total calcium, phosphorus, and uric acid. Right. So that you have to know, even though they have given a reference range. So this come under clinical biochemistry. So every physician, surgeon should know to interpret these things. And also now even these are interpreted by the specially trained physician. We call them clinical biochemist or chemical pathologist. In Sri Lanka now you get chemical pathologist and clinical biochemist. If the physician or surgeon has a problem regarding this blood report, so we refer and get an expert opinion because they are the expert. Chemical pathogens are the expert. Now look at the first component, right? Blood urea. So blood urea in this patient, 45.2, it is elevated. The upper limit is 42.6, and blood urea and nitrogen also 21.12, right? So you can see other than these two parameters, this other one, creatinine, serum sodium, serum potassium, serum chloride, total calcium, phosphorus, uric acid, all are normal. So the first impression is, right, this is not a serious condition. Because why? Blood urea, right? And because the important thing is if you look at the creatinine, right? Creatinine normal, right? Creatinine in the normal range, right? So creatinine in normal range means, right? It's a balanced fluid and electrolytic results, right? So, right. So therefore, you don't have to much worry about that one, right? You don't have to much worry about that one, right? Creatinine, right? So now we'll see now here, creatinine is normal means that it's good filtering, right? So that if you look at the why high urea, because normally, right? So in blood report, you get the high urea, low urea, right? So high urea based on high protein diet, right? So look at we have a video on urea cycle, so then you will get it right. So high urea because of the dehydration, high protein diet, kidney dysfunction, heart failure, bleeding in the gut, right? So then low urea means liver failure, malnutrition, or low protein intake, or overhydration, right? So now next one is the blood urea nitrogen, BUN. So I'll tell what is the difference of this one later. Right. So high BUN also because of the kidney dysfunction, dehydration, high protein. So heart failure and gastrointestinal bleeding. Right. Low urea is malnutrition, liver disease. Right. So fluid overload. So we can't exclude here. It could be because of the liver disease as well, because we have to study for the liver also. We have to because that this patient had a stage 2 fatty liver without alcohol. So he's little bit obese. So that if the dietary modification cannot help, so we have to go for medication also that will risk. This is a real case, what we encountered yesterday, right? So creatinine. So that means so that there's a good sign creatinine, right? So if creatinine is high, again kidney disease, dehydration, muscle damage. Muscle damage, there's a name called rhabdomyolysis, and some medication also high creatinine. So low creatinine, low muscle mass. Low muscle mass, so elderly people, right? So even if you amputate your part of the leg, sometimes you may have low creatinine, right? So you can see now here serum sodium. Serum sodium also in this patient in the normal limit. So serum sodium, right? So high sodium we call hypernatremia. High sodium we call hypernatremia. So hypernatremia because of the dehydration, excess salt intake, diabetes insipidus, and some medication, right? So that if you have high sodium, you get the thirst, confusion, and coma. You get a coma also that if you have very high. Low sodium, overhydration, heart failure, liver or kidney failure. So SIADH, syndrome of inappropriate antidiuretic hormone, right? Next one, serum potassium. In this patient, serum potassium also in a normal range, right? Serum potassium also in a normal range. So causes kidney failure, tissue breakdown, trauma, burns. So that means if this is high potassium you see in it, that's called hyperkalemia. Hyperkalemia, so tissue breakdown, burns, and also ACE inhibitors also can make high potassium. Right, they call hyperkalemia. So low potassium we call hypokalemia. So if you had excess vomiting, then diuretics. If you take Lasix, then malnutrition. If you are not eating enough, right? So that means so if you have high potassium, you get irregular heartbeat. If you have a low potassium, you get a muscle cramp, fatigue, abnormal heart rhythm. So serum chloride. So high serum chloride we call hyperchloremia. So causes dehydration, kidney dysfunction, metabolic acidosis, excess IV saline. So if you have given excess IV saline, so you may get the uh, high chloride because that saline has saline is sodium chloride, right? So low chloride, hypercholeremia, hypercholeremia. Hypocholeremia means low chloride. So reason vomiting, that means diarrhea, burns, and metabolic alkalosis. So if you have low chlorine, you get a muscle weakness, right? Confusion, those. Total calcium. So total calcium in this patient, it is normal. Total calcium, it is in this patient, it is normal. So you and high calcium we call hypercalcemia. So causes hyperparathyroidism, cancer, excess vitamin D. So some people take excess vitamin D supplement, so that is bad, right? Effect, constipation, confusion, kidney stones, and bone pain. Low potassium, low calcium, that's called hypokalemia, right? Vitamin D deficiency, hypoparathyroidism, and kidney disease. Effect, muscle cramp and tingling seizures. Phosphorus. So in this patient, phosphorus also at the higher level. So we call hyperphosphatemia. Hyperphosphatemia cause kidney failure, excess intake, tumor lysis syndrome. That's write down tumor lysis syndrome. And then you get a itchy bone, joint pain, calcium deposit. Low potassium, that is called hyperphosphatemia, so causes malnutrition, alcoholism, refeeding syndrome. Write down what is refeeding syndrome. Hypophosphatemia, right? Effect, weakness, bone pain, breathing difficulty. Uric acid. So uric acid in this patient is normal. If the uric acid is high, you can get gout, kidney dysfunction, high purine diet, red meat, seafood, right? So in this patient, right, uric acid also in a normal range. Low uric acid caused by the liver disease, certain medication, and SIADH, syndrome of inappropriate antidiuretic hormone, right? So this is the, why that we have done this test, right? So why it is done? So it is helping to detect kidney disease or damage, dehydration, electrolytic imbalance, right? So impact on condition like diabetes and hypertension in the kidney, right? So blood urea nitrogen measure nitrogen waste. Increase means kidney dysfunction, dehydration, right? Serum creatine, kidney marker for kidney filter, GFR. So reduce kidney function. That means, so in this patient, kidney function is not reduced. So that means actually it is not too bad. So I'll tell now here the actual one. This patient had a stone, if I simply say, small stone in his right kidney, and the kidney has passed down. Kidney stone has passed down to the ureter. So when the kidney stone, when the small stone less than 5 millimeters, so when it passing down through the ureter, you get a muscle spasm. It's a really severe pain, one of the most severe pain. So we call ureteric colic, and it radiates to the groin area, right? You get sweating, vomiting, and also because of that, you can get the acute kidney injury, because normally, because we just thought it is about 1 or 2 days that this blockage, because when the stone come down through the kidney, so suddenly there's a shock to the kidney, no? Because then what happened? So because of that, probably that means, we have two kidneys, no? So because, and also that when the patient is, too scared, and patient hasn't taken his urine output. We try to take urine on the admission, no, because your bladder is empty. So that is also reason blood urea level is high. And also patient had eaten a lot of seafood at that day, right? So because of that only blood urea has increased, because kidney had a mild injury definitely, because why? Kidney stone, where we don't know at the beginning where was, probably the upper part of the kidney, so it was flushed down. So when it come into the ureter, right? So then you get the spasm, pain, that is called uh, right, ureteric colic, right? So then what happened, that the kidney has blocked, no, the urine filtration has blocked. So because of that blood urea, because that there's a minor injury to the kidney, we call this injury to the kidney. So that may be the reason, blood urea and the blood urea nitrogen increase. So then we ask patient to take a lot of water, right, rehydrate, and it's a severe pain. We given a pain medication to the this one, and the patient yesterday morning, I think, no, I think today morning or yesterday evening, the patient has been discharged, right? So that is how you interpret the renal profile. So you have to know now what is renal profile, how we are ordered. And also important thing in this patient, so we did ultrasound scanning, then we got a hydronephrotic kidney. So next lesson is hydronephrotic kidney, right kidney, and hydroureter. So hydroureter means ureter has been dilated. Hydronephrosis is the, kidney, in simple I say kidney dilated, right? Hydronephrosis, right? So hydronephrosis is that kidney swell, we call say, right? So kidney swell, because that if there's a a sudden block in the ureter, so you get but it develop for some time. It exactly you don't get at the same time, but it's a 5-6 hours, because these are very delicate structures. And blood urea increasing, we assume this is a suddenly blockage of the ureter, so it may have effect on the kidney filtration. So probably that is the reason blood urea increases. And also a patient has taken a lot of seafood, that is also, and also less water also give rise to the blood urea. So this is not a very serious condition, right? So that, but we have to follow up this patient for patient doesn't have diabetes. So if because the good signs are, because all others are normal. If you have chronic kidney disease, that means a renal failure, that means a CKD. So probably creatinine, this and to these all other parameters, serum, sodium, potassium, all are imbalance. So here there are only here two factors are imbalance it slightly, so therefore you don't have to worry. So that we did the ultrasound scanning, stage 2 fatty liver, the patient is not taking alcohol, so he's little obese, so we advise them to go for dietary modification first, doing exercise, reducing carbohydrate, reducing oil intake, and we are going to see whether is there any progress, right? If there is no progress, so we have to medicate for fatty liver, because fatty liver there's several stages. So that means stage 2. Right. Stage 2 means that means a fatty liver grade 1. You get a grade 1, grade 2, grade 3, right? So grade 1 is the mild, but grade 2 also, right, reversible. Grade 2 also reversible, right? Grade 1 mild, grade 2 is a moderate, right? So that means we measure the fat percentage. Right. So now fat accumulation rate. So that means that when you have grade one is normally asymptomatic, but grade two fatty liver. Grade two fatty liver. I'm not talking about fatty liver. This is a renal profile, but what I'm saying, the patient had a fatty liver. So grade two, you feel like fullness, abdominal fullness. So grade three means bad. That means the fat accumulation is 66% of the liver's weight. So this is, inflammation, that is right. So it is, you get fibrosis, and it is, you get a liver failure. So now grade 2 fatty, this patient had a grade 2 fatty liver. So we go, since he's fat and, little, that means consuming a lot of oil. So we asked him to reduce those things and see. So after that, so after 1 month, we are going to follow up, giving a special diet plan, because that patient doesn't like to take medication. There are people. So then we are going to ultrasound scan again, and there are another test, a lipid profile, fasting blood sugar. There are so many other tests. So we are going to test those things, and we are going to assess whether this patient need uh, any other medication, right? So that is the story of this patient. This is a real case, right? This is the ultrasound scan of that same patient. So we identify that as a hydronephrotic kidney, hydronephrosis. So you can see now here. So actually, you need to look for the normal uh, kidney to understand the hydronephrosis kidney, right? So in hydronephrosis, you can see now here, in very simply I say, so that uh, renal pelvis, right? Renal pelvis. So those things dilated, right? Calyces dilated, right? So if the urethra also, right? So that means urethra also can be dilated. So that means that, so these are, right, this area. So when those are dilated, we call, right, hydronephrosis, right? We call it hydronephrosis, right? In that patient, what we referred, right? What we referred, he had this is mild hydronephrosis. You can research and see, but I simply, since that still you don't know how to identify this structure. This is the right kidney. So this is the renal calyces, right? So hydronephrosis kidney, it has so many causes: obstruction, then anatomical abnormalities, we call UPJ obstruction, VUR obstruction. And sometimes pregnancy, you get a hydronephrosis, then you get a neurological case, and also prostate issues, right? So what that patient has the unilateral hydronephrosis, right? But sometimes you get the bilateral hydronephrosis also. Some people, grade it mild, moderate. So in this one, this is slight dilatation of the renal pelvis, and you get the moderate, right? So in moderate, further dilatation with some glacial involvement, calcial involvement. Then other one, grade 3 severe, so that was a thinning of the renal parenchyma. Grade 4, very severe, advanced thinning. Right. So then kidney function is severely affected. So this one we call it a slight dilatation, right? Right. So grade 2 is kind of intermediate. That means we check it with the uh, radiologist, so that he said that is a kind of some calcial involvement. right? This is mild, the kidney with the mild hydronephrosis, right? Mild hydronephrosis. So that I'll show you now here normal kidney and the hydronephrosis kidney ultrasound scan, right?